Thank you so much for your interest in the Live, Love, Breathe respiratory and lung exerciser device. This revolutionary device has been designed, manufactured, and assembled in the U.S. and is uniquely positioned to positively impact the lives of millions of people by increasing lung strength and capacity, peak cough flow rate, and most importantly, recovery after respiratory illness. Although other respiratory muscle trainers have been clinically proven to help with reducing dyspnea ratings for individuals with asthma and COPD, the Live, Love, Breathe lung exerciser has been specifically developed with post-COVID-19 recovery in mind. And now that hospitals and medical centers like Cedars-Sinai, Cornell Medical, and Columbia University are recommending legacy respiratory restorative devices like spirometers to speed lung recovery for patients post-COVID-19, there's no better time to invest in a product that can dramatically improve the short-term and long-term well-being of the 25 million Americans with asthma, 16 million Americans with COPD, and the 28 million and growing number of Americans recovering from COVID-19. From our entire team at Blue Echo Care, thank you for your time. The Live, Love, Breathe respiratory and lung exerciser device is your one-stop ticket for healthier lungs and a healthier you. Created, manufactured, and assembled in the United States, the Live, Love, Breathe exerciser was expertly designed to treat respiratory conditions like asthma, COPD, bronchitis, dysphagia, and cystic fibrosis. It works to decrease your labored breathing and improve your vent weaning and peak cough flow, which allows easy elimination of mucus and improved speech and swallowing performance. In this video, you'll learn how to prepare your device for usage, how to properly breathe while using the device, what resistance setting is right for you, and how to clean your device when finished. Thank you so much for your interest in the Live, Love, Breathe exerciser, and we look forward to helping you obtain a healthier, happier you. Before using your Live, Love, Breathe lung exerciser, turn the inhale and exhale to the desired resistance strength, 1 being the easiest, 6 being the hardest. If it's your first time, we recommend setting the resistance to 1. But here's a quick way to determine which resistance setting is right for you. Turn both the inhale and exhale knobs to 1. Then breathe in for 1 minute. If after a minute you're breathing easily enough to hold a conversation without difficulty, then the resistance is too low and you need to increase it. If you're breathing heavily and you can barely speak in full sentences, then you're at the optimal resistance setting for exercising your lungs. If your breathing is labored to the point where you can't speak or you can only say a single word, you should stop, catch your breath, and reduce the resistance level. If you're already at 1, then begin breathing exercises without the device. Over time, you'll be able to work up to using the device. With your resistance level now set, it's time to begin. Make sure you're sitting comfortably upright so you can take long, deep, natural breaths. Attach a clean mouthpiece and start breathing from your diaphragm, ensuring that your shoulders stay loose and relaxed. For the first week, spend 10 minutes using your Live, Love, Breathe exerciser daily, 6 days a week. For the second week, increase use up to 2 times daily. If you're having trouble getting through 10 minutes on the first setting, that's okay. Stopping and starting again is totally fine. Your goal is to increase the intensity of your exercise over time in one or all of the following ways. Increase your duration of your session, increase the resistance level of your session, or increase the number of sessions you're doing daily. It takes approximately 4 to 6 weeks to start seeing results as your blood flow increases and your lung muscles develop. So it's important to be patient. Consistency is critical. When you finish a session, remove the mouthpiece and wash the parts in warm water with soap or vinegar. Then let air dry. We recommend washing your mouthpiece after every use and the body of your device every day. You can wash your mouthpieces in the dishwasher but only hand wash the body. And remember never to boil any of the components. Thank you again for your interest in the Live, Love, Breathe Respiratory and Lung Exerciser. It's important to remember that if you're experiencing breathing difficulty that interferes with your daily life, prevents you from sleeping at night, or is accompanied by fever, chest pain during inhalation, excess mucus production, fatigue, or unexplained weight loss, please consult a physician immediately.